All right, welcome to the second video in chapter 7, where we're going to finish our discussion on blood. Now, we did an overview in the first video of blood, the components that make up whole blood, and we discussed kind of what's in the plasma, what's in the red blood cells, white blood cells, and platelets. We're going to kind of continue our discussion with blood, and we're going to look at hemostasis. We'll talk about how blood clotting happens and how our bodies try to prevent a lot of blood loss through that hemostasis process. And then we'll talk about blood types in this module, and then we'll have a third video where we discuss kind of the diseases of that can affect our blood. Okay, so first we're going to look at how our bodies stop blood loss. Right? So hemostasis. So there are 3 specific stages that happen during this process. You have your vascular spasms, you have your plug formation that's made primarily up of platelets and other material, and then you have coagulation. Coagulation is the actual formation of the blood clot, where the blood changes from this liquid kind of substance, because it's primarily water, right? But changes from that liquid to a gel-like substance due to reactions that are affected by several different clotting proteins. So there are approximately 12 or so clotting proteins that are involved in this coagulation process. We're not going to go through those, but just know that those different clotting proteins help change that blood from its kind of liquid state to a more viscous gel-like solution that helps to prevent blood from leaving the damaged vessels or tissue. Okay. So once that damage happens to the vessel and there's a breakage in the tissue layer of that blood vessel, that hemostasis process will happen. So first you'll get platelets to release what's known as a prothrombin activator. This prothrombin activator converts prothrombin into thrombin. Okay, so this protein basically is converted into an active enzyme. The enzyme thrombin will then convert fibrinogen to fibrin. Okay, so fibrinogen is a plasma protein that's soluble, meaning that it can kind of dissolve, to a insoluble fiber. Okay. Now, once this happens, this fibrin is present. You have a mass of fibrin that will be mixed in with platelets and other trapped red blood cells that have been passing by throughout this process. And all of that kind of mass and mixture of stuff together will form the blood clot. Okay? And so then that clot will contract and tighten and will hopefully prevent any more loss of blood from happening. Okay, so to take this, sentences of confusing words and terms and to try to make it simpler into a figure, okay, we have our 3 steps of hemostasis, right? So you have your vascular spasm, you have your plug formation, and then you have your clot formation. So you have your damage, right? This is causing the bleeding. So your vascular spasm is basically where the blood vessels contract around where that damage has happened. Okay? And so what that does is it reduces the blood flow that would be moving into that damaged area. So that in itself helps to reduce how much blood is lost. After that, you have the platelet plug forming. So all of the platelets will come in and they will adhere and bind to one another and try to start plugging that opening of the damaged vessel, right? And then you start getting the release of prothrombin being converted and then causing the conversion to thrombin, right? So these here, and then the thrombin converting the fibrogen into fibrin, right? So you're going from prothrombin to fibrin so that that fibrin, right, that fibrin strands can bind with the platelets that are in that platelet plug and the red blood cells to basically form this insoluble mesh of material that is forming that clot. Okay? And so all of this together will form that gel-like material, right? That is what is the clot. Okay, so you have that vascular spasm, the platelet plug, and then you have the release of that prothrombin, right, converting to thrombin and then fibrin, and then your fibrin strands helping to form that clot. Now, we mentioned earlier that you could have a clotting disorder, right, which is where you have a deficiency in one or more clotting proteins. And this disorder is known as hemophilia. So if you have hemophilia A, you basically lack the clotting factor 8. However, we have, not we, but the medical field has developed factor 7A that can be made to supplement the hemophiliacs, basically to supplement the lack of this factor 8. And so that can help with the clotting that they're not able to do on a normal basis. There are also some medications that can prevent platelets from clumping and binding together. And medications that do that are things like aspirin, right? So aspirin will, quote unquote, thin your blood and cause you to bleed a little more than you would if you hadn't taken that medication, because it's blocking the presence of those platelets clumping together, basically preventing them from clumping. Now, what we're going to get into next is the various blood types that we can have, okay, that's found in humans. And blood typing is really important because of blood transfusions. Okay? So a blood transfusion is when somebody has lost a lot of blood and doctors, nurses can give that person blood that had came from another person to supplement that loss, right? So they're basically administering blood directly into the bloodstream that come from another person. Whether or not that blood transfusion is successful depends on the blood types that are given to that transplant or during that transplant. So if you give the wrong blood type to the recipient, then the recipient could have a really bad negative reaction, and it could be fatal to that recipient. So it's really important that we get the blood types right during these transfusions. Now, the various blood types that humans can have are known as the ABO blood types. So a human can have an A blood type, a B blood type, an AB blood type, or an O. Okay. Now, each of these blood types also could have an RH factor. This basically means that if you were RH positive, then you would be A positive, right? Or you could be A negative if you're RH negative, right? But it doesn't necessarily have to be A blood. You could be B positive or you could be B negative. So what these positive and negatives basically say is that you either have the RH factor or you don't have the RH factor. Okay? So not only do we have to worry about RH factors, whether they're positive or negative, but we also have to worry about blood types, right? So we want to get the specific blood types and look at whether or not those blood types are positive or negative. Now, with blood types, our bodies will make antibodies based off of the antigens that are present on the blood. Okay? So the antigen is basically a non-self protein that is foreign to the body. Okay? So an antigen can be on a cell, say from another individual or from a bacteria or a virus that's invading. And the antigen will be read, that protein will be read by an antibody. And the antibody is a defensive protein that defends against specific antigens. Okay? So, like for example, there are certain bacteria that our bodies have antigens for, or I'm sorry, that our body have antibodies for, and those antibodies will respond to the specific antigens on those bacteria. Right? There are lots of other antigens and antibodies that are present, throughout our bodies. And so antibodies are those gamma globulins that we talked about earlier. So those proteins found in the plasma. And like I mentioned, those antibodies can help with infectious microbes. However, antibodies can also be directed against antigens like those that are on blood cells that come from a donor to a recipient during blood transfusions. And if you give the recipient the wrong blood type, then the antibodies of that recipient will react to the antigens of that donor blood, causing very bad problems. And that those problems are that the antibodies will bind to those antigens on those foreign blood cells, and they could clump together and inactivate those foreign red blood cells, and they could cause this clumping and basically clotting in the bloodstream, which could cause fatal results if not monitored or caught appropriately. And so, for example, if you have a specific blood type and your blood type has this shape of an antibody or an antigen on the red blood cell, it would make the antibody for the opposite blood type. Right? And so it would only bind to a red blood cell that had this antigen, so this kind of pointy antigen, because that's the only site that antibody can bind to, right? So this antibody can't bind to the sphere shape, there we go, but it can bind to the triangular shape. And so those antibodies would attack and bind to all of the cells that had that specific antigen. Right? So they would form these complexes and clump together, causing bad reactions during that blood transfusion. Okay. And so how do we know which ones have which antigens and which ones have which antibodies? Well, basically, the antigen on the red blood cell surface determines the red blood type. Okay? So if you have an A blood type, then you have an antigen for A. If you have a B blood type, then you have an antigen for B. If you have an AB blood type, then you have both A and B antigens. If you have an O blood type, right, you have no antigens, so no proteins on the surface of the red blood cell. Whatever antigen you have, your body will make an antibody for the opposite antigen. So if you have A antigens, your body will make B antibodies. If you have B antigens, your body will make A antibodies. If your body has A and B antigens, then you have no antibodies. If you are O, you have no antigens, so your body has both A and B antibodies. And this is important in determining what type of blood can receive another type. Okay? So if the recipient of a blood transfusion has antibodies against the donated cells, then that could be a fatal reaction. So individuals have antibodies against the antigens, not their own red blood cells. Okay? So we got a figure kind of summarizing this. So blood type A has A antigens, the A proteins on their red blood cells. So their body is going to make B antibodies. Okay? If you are a type B, you have B antigens, and your body's going to make A antibodies. Right? And notice the shape of the binding sites for these antibodies. These antibodies are only going to bind to this antigen. This antibody is only going to bind to that antigen. Right? So a person with type A blood cannot receive type B because this antibody will bind. A person with type B blood cannot receive type A because this antigen will bind to that, this antibody will bind to that antigen. Okay. Now, if you are type AB, you have both A and B antigens. So this means that a person with B blood type cannot have AB blood because this antibody will bind there. That person, if you're type A, you also can't get AB blood because this antibody will bind there. And if you're a person with type O, you can't get AB because you have both. Right? Those antibodies are going to bind to both antigens. Okay? So AB blood types can only donate to AB, right? Because AB has no antibodies, so it can receive AB. But it also can receive B. Let me erase this. Right? So AB can receive B because it has no antibodies to bind there. AB can receive A because it has no antibodies to bind. And AB can receive O because it does not have any antigens to bind to as well. Right? Now O, so AB can receive anything. Right? So it's the universal recipient. Okay. However, O is a universal donor. So O can be donated to AB, it can be donated to B, and it can be donated to A because it does not have any antigens. And so the antibodies are not going to attack it. Okay? And so we have this scenario here where an individual with type A blood can only receive blood from A or O. An individual with type B can only receive from B or O. An individual with type AB can receive from any, right, because it has no antibodies. The individual with type O can only receive from type O because, remember, O has no antigens but both antibodies. So O can only receive from O. Okay? But O is the universal donor and can donate to every single blood type. Right? See, O, 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 and O. So those are the blood types and kind of how and why we determine those. Now, if we look at the Rh factor, right? So the Rh factor is another antigen that's on the red blood cell. Okay, this antigen, you either have it or you don't. So if you are Rh positive, so like if you are A positive, B positive, O positive, AB positive, it means you have that Rh factor. And a majority of Americans are Rh positive. If you are Rh negative, so like A negative, B negative, etc., it means you do not have that antigen present on the red blood cells. Okay? And these individuals will respond to Rh positive blood by producing anti-Rh antibodies. So if you are Rh negative, right, and you get a transfusion that is Rh positive, your body will begin to produce the antibodies for that Rh positive blood, and then that those antibodies will attack that Rh positive blood. Okay, so negatives should only receive blood from negatives. Okay, so it can be, so this also can be a problem whenever you have, for example, an Rh negative female and she has a fetus, she's pregnant, and that fetus is Rh positive. Okay, so what can happen is that the mother could produce antibodies against that Rh as the Rh positive blood from the fetus kind of transfers through the umbilical cord, through the placenta, and into the mother's blood, causing the mother's blood to produce those antibodies. And then the antibodies from the mother can affect that Rh positive blood from the baby, causing a hemolytic disease. Okay? And this hemolytic disease is actually a higher risk if the mother has, say, a second or third pregnancy, because the first pregnancy would actually cause the antibodies to be made, and then the second pregnancy, the antibodies can carry over to the fetus and affect the fetus and the fetus's Rh positive blood. Now we can prevent this by giving the mother RHO GAM during pregnancy and during delivery to help kind of prevent this hemolytic disease from happening. So basically we have this scenario here where the husband is Rh positive, the female is Rh negative, but the baby inherits the Rh positive from the father, right? And so when that happens, right, you have the Rh negative mother, Rh positive fetus, and what can happen then is that Rh positive blood can travel through the umbilical cord into the placenta, and then through the uterus into the mother's red bloodstream or the mother's bloodstream, causing this to interact and create those right anti-Rh antibodies. And then let's say the mother has a second pregnancy, okay, right, with her second Rh positive child. Those antibodies will then travel through her bloodstream into the baby's bloodstream and can attack the fetus's red blood cells, which could be a big issue in terms of affecting the fetus's kind of blood circulation because of that clumping factor that would happen with those antibodies attacking the red blood cells. Okay. All right. We have a little video to kind of go over blood typing and that Rh negative and Rh positive example, just to kind of give you a little more insight if you still have questions or issues.
Red blood cells, like all cells, have surface proteins on their plasma membranes. Surface proteins, commonly referred to as antigens, help the body recognize self versus foreign cells. ABO blood type refers to the different surface antigens on red blood cell membranes that help the body recognize self. Type A blood has A antigens. Type B blood has B antigens. Type AB blood has both A and B antigens, while type O blood has neither A nor B antigens. All individuals have antibodies circulating in their blood that bind to foreign antigens, thus initiating an immune response. If a person of one blood type receives blood from a person of an incompatible blood type, antibodies in the recipient will attach to the surface antigens of the donor blood. This antibody attack causes the donor red blood cells to agglutinate or clump together. Persons with type A blood have antibodies to the B antigen. Persons with the type B blood have antibodies to the A antigen. Persons with type AB blood have antibodies to neither A nor B antigens. And persons with type O blood have antibodies to both A and B antigens. A person with type A blood can only receive blood from a person with type A or type O blood. A person with type B blood can only receive blood from a person with type B or type O blood. A person with type AB blood can receive blood from a person of any blood type. A person with type O blood can receive blood from a person with type O blood, though they may donate to anyone.
Okay. And so the way we determine or can determine what type of blood a person has is through simple blood typing exercise. And again, if we were in face-to-face labs, you would actually do this blood typing with synthetic blood in a lab setting, and you would get to see all this firsthand. And so what you'll want to do in your lab exercise is you'll just want to read through the exercise and make sure you understand how these different scenarios should happen and play out if you were doing a blood typing test. Right? And so what we basically do in a blood typing test is we take a sample of blood and we put that sample of blood into different kind of wells. So you would have like a plate, right? And on that plate, you would have, say, like anti-A and then anti-B, right? And then you would have like little wells, right? So little divots in that plate where you would put a sample of blood in each plate. Okay. And you would then, right, take your anti-A and put in each of those. So it would be like type A, type B, type AB, and type O. And you would put the antibodies in that well. And so if, say for example, you put antibody A in this well and it's type A blood, you would expect it to agglutinate and to clump because it had the antigens for A, right? Whereas because if it was, you know, antigens for B, then it wouldn't associate with the A, right? Or the antibodies for B, it wouldn't associate with the antigens for A. Right? And so you would add the anti-A and anti-B to the different samples being tested, and then you would just look for clumping. And so then you can do this to determine whether or not what blood type each person has, the donor and the recipient, so that you can make sure you have a good match. And so you want to see no agglutination, right? And so this is basically what I was trying to draw. Right? So you would have your plate with your different wells, where you would put your, say, sample of your blood in the plate, and then you would add anti-A antibodies. So basically the antibodies that bind to the A antigen. So for example, these would be the antibodies found in B blood. And then you would add the anti-B antibodies. And so this would be the antibodies that you find in A blood, right? And so if the anti-A antibodies agglutinate and clump, then you know it's type A, right? So like in this example, the anti-B antibodies agglutinate, so that means that it's type B and it contains the B antigens. When both agglutinate, so if both the A and the B agglutinate, then you know it's type AB because it has both A and B antigens. Now, if none of the samples agglutinate, then it's type O because neither of those have, that cell has neither antigens, right? So just remember going back to here, right? So your antigen, so you're basically adding these to the cell, right? So if you have like your sample of blood, you would add B, right? And the antibodies for B. And if it's A, it's not gonna agglutinate because these only bind with those. But if you add anti-A to the cell, then it would clump because they would bind to those, right? So that's basically what you're doing there. Okay. There are some blood substitutes that exist where we can use kind of like synthetic blood substitutes. One, these are important because we know that these don't have diseases that could exist in donor blood. So there's always the issue of potential diseases being transmitted from donor to recipient. The type of blood that you need may not always be available. So for example, if we look at this chart again, you see that AB is pretty rare compared to A, right? And so if you are a person with AB, you may not have AB donor blood available. And so you would need a blood substitute for AB so that you could get your transfusion and hopefully save your life. There's also limited storage of these whole blood, donors. You need space to store this blood. And then, sometimes we just can't meet the demand for donor blood, right? We just don't have enough people donating to make sure that we have that sufficient stockpile of donor blood when it's necessary. So blood substitutes can be used in that case. There are two types of blood substitutes. You have basically one where it's just modified hemoglobins in a sort of aqueous or water solution. You have to package those hemoglobins in some way, but basically you're delivering the hemoglobin to the person's bloodstream so that they can have enough red blood cells, hemoglobin-like cells, to transport oxygen. And then you have what's known as perfluorocarbons, so PFCs, and again, an aqueous solution that carries oxygen throughout the person's body. Right? So you're basically trying to supplement the oxygen carrying capacity that you lose from not having as much red blood cells when you lose a lot of your blood. And so the final thing we're just going to mention are some blood disorders. So the first is infections, so mono, right? So the kissing disease, which is also which is the Epstein-Barr virus. So this affects your lymphocytes. This is like really bad flu-like symptoms that's affecting the blood. You can get blood poisoning, which is when you have a bacterial infection. So this is your septic. Right? So when you have infected wounds, infected burns, urinary tract infections that haven't been appropriately handled, this can lead to sepsis. And if you have, or another one that a lot of people just may not pay attention to or realize is that if you have a tooth infection, like an abscess that gets really bad, it could cause blood poisoning, which could be life-threatening, and it requires antibiotic treatment for you to get rid of. And again, if you don't get rid of it, it could be fatal. Another disorder is anemia, so basically where you have a reduction of oxygen carrying capacity due to a low number of red blood cells, or you may not have a lot of hemoglobin in your red blood cells. So you can have a lot of red blood cells, but hemoglobin is just not packing efficiently inside of those red blood cells. So there are different types of anemia that you can get. You can have an iron deficiency anemia, which is a lack of iron. And remember, iron atoms is what the oxygen binds to on the heme molecule. So if you don't have that iron, oxygen can't bind. Hemorrhagic anemia, which is just low red blood cell concentration due to just a lot of blood loss. You have pernicious anemia, which is caused by a low vitamin B deficiency. Hemolytic anemia, which is where you basically have your red blood cells being destroyed. And so your body's getting rid of those red blood cells for some reason. And because you're losing those red blood cells, you're losing your oxygen carrying capabilities. And you also can have anemia due to renal failure. And so renal failure is where your kidneys aren't functioning properly. They're not secreting that EPO hormone, and your body's not making enough red blood cells as a result of that kind of reduced concentration of EPO. Now, another big disease of the blood is leukemia. And so this is where you basically have a proliferation of white blood cells. So this is actually a type of blood cancer. You can have acute leukemia or you can have chronic, depending on the type and the stage. You'll either have radiation or chemotherapy or a combination of both. And you will also have bone marrow transplants to kind of help stabilize the overproduction of those white blood cells. Another disease is multiple myeloma, which is where you have a proliferation of your plasma cells in the bone marrow, and this causes a weakening of your bones. And both of these are really big types of cancers that affect a lot of people worldwide. And then the last disease we're going to talk about for the chapter is thrombocytopenia, which is just where you have a reduction in platelets due to some sort of infection or leukemia or anemia or some other factor like radiation or medications that you've taken. And this can lead to a lot of unusual bruising, so like you bruise easily, and unusual bleeding that's not normal again, because you have a reduction in platelets. And remember, platelets make that plug during the hemostasis process, so that's that second step. You have a reduction in platelet number, then you're not going to make that platelet plug. And this is different from hemophiliacs, because remember, hemophiliacs aren't making the clotting proteins. right? And so platelets are different from the clotting proteins. So this instance here is just where you have a reduction of your platelets. And so that's it for chapter 7. So that's our discussion of the blood. In the next module, we'll go through the heart and the blood vessels. So veins and arteries, and we'll talk about, kind of the makeup of the circulatory system in terms of the heart and the blood vessels, and kind of how they're structured and how they flow throughout the body. And so with that, let me know if you have any questions, any concerns. Send me an email or in the discussions for the class. And I hope you have a good rest of your day, and we'll see you in the next module.